Not all exosomes are created equally. Allow me to explain. Exosomes are entirely dependent on their characteristics based on where they're sourced from. So the exosomes we use for skin are not the same ones we use for bone, are not the same ones we use for hair, etc. It is very important to understand this so that you know which exosomes to utilize for which treatment. In skin rejuvenation, we tend to utilize exosomes that are derived either from umbilical cord stem cells or from adipose tissue, as they tend to have characteristics that allow them to encompass factors that improve fibroblast activity, elastin and collagen formation, which give us all the benefits of skin rejuvenation. In hair restoration, we utilize exosomes that are derived from placental tissue or from mesenchymal stem cells that allow for upregulation of growth factors such as VEGF, IGF-1, FGF, things that allow for upregulation of blood supply to the scalp and allow for the reawakening of dormant hair follicles, improving hair growth. In orthopedics, we utilize exosomes that are derived from mesenchymal stem cells or from bone marrow because they have regenerative properties that are beneficial for cartilage repair and for inflammation modulation. So as you can see, if I utilize an exosome for the joint, it's going to do nothing for the skin, and vice versa. So it's important to know that when you're treating your patient. Another key note when you're treating your patient, the only way to really get around the very stringent FDA guidelines about utilizing exosomes is to be a part of a clinical trial for a specific exosome being tested. The FDA is very particular about this and is really coming down on the utilization of exosomes across the board and sort of the free for all that people kind of had a while back. Now, the only way to really get your hands on an appropriate exosome and to utilize it in a kosher manner in your clinic is to do it under clinical trial and to inform your patients that it is very much an experimental treatment. So that when you're getting informed consent, that is part of your informed consent protocol. It is also very important that you understand the purification process, the sourcing process of the exosome that you're using, because it is usually during that time where if anything goes wrong or if anything is inappropriate, where if that exosome isn't being appropriately handled or comprised, if you inject it later or apply it later onto your patient, even topically, that is when those risks that the patient can receive, that is when those risks can occur. Usually, if everything else otherwise goes well with the purification and the sourcing process and it's all done appropriately, that significantly minimizes any risk factors to your patient. So if you utilize a very trusted and appropriate source that is compliant with all the FDA guidelines, that is really to your benefit and to your patient's benefit. As a patient, it's really important for you to also be well informed, and these are questions that you can ask your practitioner to see whether or not they are part of a clinical trial, if they know anything about the exosome that they're applying onto you. And also, there's an FDA website that you can check out that will sort of red flag any companies or any clinics that have sort of practiced outside the guides of what they should be doing. As always, I hope this video helped you out, and let's always stay learning.